Dear friends, 8th of May is observed as the World Thalassemia Day. As we all know, there are about 10 to 15,000 children who are born with thalassemia every year in India. And we are the thalassemia capital of the world, something we should not be proud of. Now, what can be done? So this day is a calling for three things. One is that thalassemia children who are already suffering from thalassemia can have a very good quality of life. They can live long if they are managed properly and adequately. By that, what I mean is that if they are transfused blood at good levels, maintain the blood levels before giving transfusion in the range of 9.5 to 10.5. Now, as we all know, blood brings with it problems of iron overload, and that iron has to be chelated. We call this treatment as chelation, to reduce iron from the body so that their organs do not get damaged. So all the thalassemics out there, please do these two simple things: maintain blood levels of 9.5 to 10.5 and maintain your iron levels, which you call as ferritin, as close as 1000 as possible. That's one. Second is, thalassemia is a curative condition. We can cure this condition. We can cure this condition by a bone marrow transplant or by gene therapy. Of course, gene therapy is not available in India at this point of time, but what a lot of groups are working on this, and hopefully in the future it should be available. But at this point of time, bone marrow transplant is available, and we have been doing bone marrow transplant for thalassemia for almost a decade now in India as well, and there's a lot of experience of bone marrow transplant in India. So please consult with your hematologist, with your transplant physician, and if your child is eligible for transplant, please go for that, because that is the only curative option available at this point of time in India, and the results have become very good in the last decade or so. You can have a family match donor who can be a donor. You can have outside donor who was called as unrelated donor, and you can also sometimes have your half match mother or father as a donor. And these all three types of donor transfers are available in India at this point of time. Now, the third, which is very, very important, is that thalassemia is preventable. We can prevent this condition. Now, how we can do that? As we all know, the thalassemia major parents are thalassemia carriers. They carry one gene which is abnormal and one gene is normal. Because they have one normal gene, they're absolutely unaware of their thalassemia carrier status. Now, this cycle of thalassemia major can be broken. How? If both the parents who are expecting a child or planning for a child or planning to get married, if they do a simple test called HPLC, they will know whether they're carriers or not. If one of them is a carrier, absolutely no problem. They can go ahead with the pregnancy without any precautions. If both are normal, again, nothing to do. But then if both the parents are carriers, then in that case, we can do a simple test where we can see whether the child which are expecting is having thalassemia major or not. And hence, we can prevent birth of thalassemia major children. Now, I think this is the responsibility of the whole country. We need to spread awareness about it. The NGOs working in the field, and a lot of NGOs in the thalassemia field who are doing a fantastic job. There are a lot of advocacy groups doing a fantastic job. The government of India has got a good focus on this. The hematologists, the families of thalassemia patients have got responsibility of educating each other, educating the community at a large, and try to make India thalassemia free, which is absolutely possible and is something which is required, so that we break this cycle of thalassemia major in our country. Thank you very much, and let's all work towards that goal.